Health screening is a healthcare tool, actually strategy to detect any diseases early before the signs and symptoms manifest. Okay, the importance of this health screening is for us, as what I mentioned, it detects the disease early so that we can treat, promptly give the proper treatment so that we can cure the disease or reduce the complication morbidity. On top of that, we also will identify the risk factors a woman having for her to develop this kind of diseases in future, so that we can preempt her and we can educate her how to come and see doctor when needed. Third thing, it educates and also gives advices on healthy lifestyle, on diet, on exercises, and educate on other healthcare facilities like vaccinations and all that. Screening, it's an important thing, especially once you cross 30. Last time we used to say after 40, 45. Now I think we are coming down and down. I think women, once they cross 30, they should do regular screening. Okay, at least 2 years once. But once you are more than 40 years, you have to start doing every year. Okay, you have to go to your physician or your general doctor. What they'll do, they will take a thorough clinical exam. They will take a thorough history. Then they will do clinical examination. With that, they will do certain kinds of blood tests, diagnostic tests, and also some ECG, X-rays, some pelvic examination and pap smears, and mammograms. Okay, when we talk about the blood tests, we are looking at the blood counts, we are talking about the glucose level, we are looking at the liver function test, we are looking at the kidney, cholesterol levels, and we also screen for cancer markers, cancers like breast cancer, ovary, colon cancer, and etc. And same time, we are also looking for some infections, the common ones like HIV and hepatitis B. Then, of course, we shouldn't forget that we need pap smear. Pap smear is to screen for cervical cancer. Then we have an ultrasound. Ultrasound we do for checking for breast, okay, any lumps or any cysts. Then we do ultrasound on abdomen to look at your liver, kidney, then pelvic ultrasound for uterus and look at any cysts in the ovary. Okay. Then, like what I told you earlier, X-ray. X-ray is looking at your lungs and the size of your heart. And ECG. ECG is basically looking at your conductivity of your heart. And mammogram. Mammogram, every woman who is more than 40 years old, they should do mammogram to screen for any breast cancers. Now the common problems are still the number one problem for women or men is heart disease. Okay, it contributes to 29% of the overall women death throughout the world. Okay, then comes cancers. Cancers are second. Cancers, among cancers, the most common cancer for women is breast cancer. It contributes to around 1% of total women death throughout the world. Okay, then second is colorectal cancer, dealing with our small, big bowel and the rectum. Then the third cancer is cervical cancer, and fourth is lung cancer, and fifth one is ovarian cancer. Common problems what all of us have is diabetes and hypertension, which all of us globally have to screen for. Then now another common problem which is arising among younger ladies between 20 to 40 is polycystic ovarian syndrome. This is a disease or spectrum of disease where most of these ladies will be obese, and they will have irregular menses, and they will have complications like not able to conceive, and same time later part in their life they will develop diabetes mellitus. And nearly 10% of total women population in the world are having this problem now. Okay, and finally, ladies who have already menopause, they have to be careful with their bones because osteoporosis can be a big problem. Yes, breast cancer is still number one cancer among women. Okay, as what I told you earlier, it contributes to nearly 1% of total death among women throughout the world. Okay, we don't have a definite causative factor. Like cervical cancer, we know 98% of the time the HPV virus is the one which is causing the problem. But in breast cancer, we don't have anything as infection or anything. But certain people are more prone when they have these risk factors. Like, yes, the most important thing, once your age is increasing, as such you are more have higher risk of getting breast cancer. Then if you have family history of breast cancer, then you are more prone to get breast cancer. Third one, let's say you already had a breast cancer to one of your breasts, so you are definitely more prone to get even to the other breast. Alcoholics and smokers. Okay, a lady who attained menarche very early and attained menopause late in her age, these people are more prone. Then ladies who have their first child after 35 years old, these are the people who are more prone. Of course, when we are talking in Malaysian context. If you talk in global context, they say African women are more prone to get breast cancer. These are the few factors. And one more important factor is obesity. Once your BMI is more than 25, you are more prone to get breast cancer. No sure way. There's no sure way to prevent breast cancer. Okay, but we can reduce the risk, or we can identify the risk factors early so that we can give complete treatment. Sometimes we can just cure the patient whom we detect early. Okay, but by saying that, there are certain risk factors which makes you more prone to get breast cancer, such as healthy food. Okay, if you take healthy food, you don't take alcohol, smoking, all this, definitely you're at better situation. Okay, healthy food like more vegetables, more fruits. Okay, balanced diet. Okay, exercise. Okay, maintain your BMI less than 25. Okay, then we are talking about, please be careful while taking oral contraceptive pills and hormone replacement therapy, because if you use them for prolonged usage, sometimes this can trigger off breast cancer. Okay, these are the few factors which. And one more thing, please screen for genes like BRCA1 and 2 if you have family history of breast cancer, because if you have the genes, the risk of you getting breast cancer and ovarian cancer is higher. One more important thing which every woman should do is, you know your body well. Of course, you should come to a doctor for us to do your breast examination and send you for ultrasound and mammogram. But before that, rather than me, it's you who will know your body well. It's a very easy examination. We call it breast self-examination. Just feeling your breast every month after your menses. Don't do it during menses or before, because sometimes during menses you will have pain. So just do it after 1 week after your menses. Then you can feel it better. Yes, breast cancer can be treated. If you detect early, actually you can cure. Okay, detect early means in early stages. Okay, breast cancer can be staged according to the severity of the disease. If you come in, that's the reason we want to screen. If you screen early, we can totally cure you. When we say cure, that means you are not going to get another tumor or another lump after that. Normally we take grace period of 20 years. If you don't get back, that means in 20 years, that means you are not going to get back. Okay, so the treatment part, yes, the treatment part will be surgery. Surgery will divide it into a simple white lumpectomy, that means just excising the tumor out, or we will remove the whole breast, mastectomy. Sometimes if the tumor is even bigger, what we do, we will remove the breast, the whole breast, with the lymph nodes, in axillary lymph nodes. So this is the surgical options available. After doing the surgery, according to the stage of the disease, we will continue with chemotherapy and radiotherapy. Okay, once they have completed the cycle of chemo and radiotherapy, we will put these patients on hormone therapy, like estrogen, anti-estrogenic therapy and all that. So these are the treatments available. But the most important thing is to detect early so that we can give you complete cure.